Good morning and karibu sana to the program. In case you're just joining us, don't worry, you're just in time for the health segment that begins right now. But in case you have been with us since morning, we appreciate your company as we shift gears to talk about matters health. This morning, we are focusing on lupus. We know that the month of May is the Lupus Awareness Month, a day that we mark every year on the 10th of May, just the other day. And usually it's a day that is set aside to just create depth in terms of understanding of this autoimmune disorder. And of course, we are going to be talking about a lot that goes into just understanding what it's all about, some of the causes, the symptoms, and even get to hear real life experience from a lupus warrior who is with us in studio this morning. Allow me to let you in on my panel this particular morning. On the far right, yes, the lady I was talking about, her name is Winnie Opondo. Winnie is a lupus warrior. Thank you for creating time. And also right now is running a campaign and advocacy on awareness and bringing on board people who have worn the shoe she has worn, and she'll tell us more about that as well. And we have with us, of course, this morning, Dr. Fred Otieno. Fred Otieno is a consultant rheumatologist at Aga Khan University Hospital. Asante, Daktari.
Thank you very much.
All right. So this is a disease that, like we were sharing earlier before we even began this conversation, many have left it to be sort of like a silent topic, not knowing that it's a disease that affects millions across the country and the world at large. And that is why we want we want to talk about it. And I'd just like us to begin from the very basic, Daktari. For viewers who may not know about this disease, what can you tell them lupus is and how it affects the body?
Okay, thank you very much, Safin, for having me. This is a month of lupus awareness, and we want to create awareness about lupus. So lupus is an autoimmune disease. Autoimmune in the sense that your body's immune system is actually doing the wrong things. So Mother Nature has created for us an immune system which is meant to protect us from external things. For example, when you get germs. Mm-hmm. So whenever you get any germ, you produce certain things we call antibodies. So what these antibodies do to the germs is that they fight them and neutralize them. But in autoimmune disease, our body produces antibodies that are not now directed against germs, but now are directed against its own tissues. So when you form such kind of antibodies, you create a fight within you. That's what we call autoimmune. So there is tissue destruction, what we call inflammation. And with that inflammation, then you get the various symptoms of lupus. Yes.
All right, we'll talk about the symptoms in just a bit. But for you, Winnie, what Daktari is describing is not just a definition of a disease or a condition. For you, it is a life you have lived. I want us to talk a bit more about how you earned or acquired that title, a lupus warrior. When did you get diagnosed with lupus, and what was happening around that time, at what age? Just take us back to that moment.
All right, thank you very much, Safin. My diagnosis was in 2018, but that was after a long period of just getting sick and not knowing what was happening. I remember looking back, I think it started in 2012 when I was experiencing joint pains and just pains all over my body, but they were unexplained because I didn't know what was happening. I, at some point, went to a hospital and we ran so many tests, including diabetes, HIV, just to find out what was causing these constant pains that were on and off, but still we didn't get an answer. So the pains were on and off, but I used to ignore them because I didn't give them much thought because the way they were on and off and on and off. Year? This was in 2012. 2012. Yes. So first there's a time. So after that, those many tests, when we didn't get anything, I let it go, and it somehow also didn't appear more often. But then come 2017, immediately after I had my last child, then I think now things started happening in my body that I couldn't explain. I had extreme pain from my hair down to the sole of my feet. I was in pain, and I remember...
in your hair?
Yes.
That's pain.
There was a lot of pain all over. I remember there were times I would wake up, I couldn't wash my face. I couldn't do basic things like even taking a shower. Even just holding my little one was a problem. Yeah. So it went on for some time. I think I saw so many doctors. I think I saw about 6 different doctors who were not giving me a solution.
So all this while, from 2012 to the time you had your last child, which year was this?
2017.
2017. This is a 5-year gap.
Yes.
You have not been diagnosed yet?
Not yet. So my diagnosis came in 2018. 2018 in March. I remember that day, I woke up and half of my body was in pain. Literally, if you draw a line on me, half of it was in pain. I was in so much pain, I couldn't stand. I was crawling from my bed using my elbows. And that is the time I had very bad headache. My heart was beating so fast. I was having fever. I was nauseous. So my husband had to run me to the hospital. And that's when we came to Aga Khan. And even coming to Aga Khan, I came with the signs of arthritis. So at first, we thought it was arthritis. But when we ran a couple of tests, I had very bad bacterial infection. I had an infection that was quite high. So I was put on antibiotics. And the doctor asked me to come back for review after 2 weeks because he said we need to clear the infection first before we find out if there's something else that is wrong. So when I went back to Aga Khan, we ran all these tests. And eventually, I was informed that I have lupus. But before that, I had been seeing a doctor, a physician, just a general physician, who one day after I had several hospital visits, so I was referred to a specialist. So when I met this doctor, he took my phone. He looked at me, listened to my history, then he took my phone and took a picture of my face. And he told me, look at this. You see these rashes here on your cheeks and right across your nose. Those are signs that you might have lupus. But he told me, I cannot give you a definite diagnosis. I would need you to go and see a rheumatologist. Right. And that's where I met Dr. Otieno.
So there was a suspicion that it could be lupus.
Yes, there was already a suspicion.
Before you were diagnosed, had you heard about lupus?
I had not heard about lupus for real. But also, I remember I had a lot of joint pains. So I had been on so much pain medication before that. I remember I even saw a doctor who deals with bones because we thought my bones had issues. Prior to that, I had been treated for pneumonia. I had been treated for magnesium deficiency. I had been treated for nerve disorders. They thought that my nerves and the fingers had an issue. I'd been treated severally for bacterial infections. I think antibiotics knew me by name at some point. Yeah.
They were part and parcel of your system. Yes. But that was just because of the misdiagnosis and, you going through the wrong kind of treatment for a span of 5 years just before they
Actually, it's 6 years.
6 years before they could pick it up. We'll talk about that more because that's why we're having this conversation. The lack of information and even people just taking that bold decision that you took to go to the hospital. Dr. Run us through the types of lupus. Do we have types or it's just a single type for us to understand how it affects different people in different ways?
Okay. So lupus is actually called systemic lupus erythematosus. So systemic means, as Winnie has rightly described, it can affect any part of the body. Yeah? But we have certain types where possibly, for example, if you get involvement of the kidneys, that we will call lupus nephritis. If you get involvement of the brain and the nervous system, we can call that CNS lupus or neurolupus. Sometimes you get special skin involvement. So certain skin lesions that we see on people with lupus, we call that discoid lupus. So that depends on the presentation. But usually patients with lupus can present with many manifestations, as you heard it from Winnie.
All right. All right. Winnie, was there a specific, was you as like, you were told it was this type of lupus? Tell us a bit more about your diagnosis and the specific diagnosis that you got in terms of the type and how your body was reacting to what was happening then.
Okay, mine is SLE, the systemic one. And systemic means that a minute you're waking up and you can't move your neck.
Yeah.
Around midday, it's now on your lower back. One day you wake up and it's one arm that is full of pain. Sometimes you wake up and it's your chest. It's pressing so hard on your chest. There are times you just wake up and you have very bad stomach ache. So mine is...
So every day comes with different...
Yes,
things.
it is different, and because it is very unpredictable. You cannot tell where the next pain is going to be. For example, I would sleep very well today and I wake up tomorrow and all my fingers I have inflammation on the little joints in my fingers. I can't wash my face. I can't do anything. I can't even hold a pen or even a cup to drink tea. Yeah.
Is it excruciating pain that is really overwhelming, and were you like constantly on painkillers? Yeah.
That is pain that it doesn't have a word. It doesn't have a name to it.
It.
I can't explain it. It is pain that you yourself, you don't understand what's going on with you. But I think I have been, there are so many painkillers that are out there. There are these very strong ones, and I have been put on those very strong ones for quite some time because sometimes the pain is so excruciating, it is so intense that sometimes you feel like you're about to go mad. Yeah.
The reason I asked you that is because there could be somebody watching us, and what you're describing is exactly what they're going through. So this could actually give them a pointer that perhaps, just maybe, they could visit the nearest, health facility to get checked whether this could be lupus or it's arthritis. There's confusion there. That's why we are having this conversation. People would think, majority of people run towards the arthritis. Ukisikia tu kitu kwa joints and the bones, you think it's arthritis. Just go to the hospital. You may never know. It could just be something else. But then, how many people are we talking about? Why is this a big deal, one would ask, in terms of the estimates of those who are affected, Daktari? What are we looking at?
So we don't really have data in Kenya about the extent of people with lupus. But what you are seeing is there's an increasing incidence of patients with lupus, possibly because we are creating more awareness, especially amongst the healthcare providers. So we are training more of our doctors to be able to at least get the suspicion of lupus and appropriately refer these patients for early diagnosis. But then, as Winnie said, it took about 6 years for her to get the diagnosis. Data from the West also shows us that it takes equally long sometimes to get the diagnosis of lupus. So lupus is a very complex disease, and it's one of those diseases we say is the greatest mimicker. So patients can present with anything. It could be fevers, it could be pains. They could just come with possibly organ failures like liver, kidney failures, and so on. So it's one of those diagnoses that people should have at the back of their mind whenever you're dealing with patients whom clearly you don't understand what's going on. Yes.
So what would you say is leading to, the long duration of getting a diagnosis? Look at all aspects in terms of even what you have talked about, the nature of the symptoms that can be a bit confusing. Talk to us about the specialists who are there to pick it up. Do we have enough of those? Talk to us about even the knowledge that ought to be there, that a patient would even present themselves to the hospital. Just the cocktail of complexities that would lead to this longevity in terms of diagnosis.
Okay. So I think the longevity in terms of diagnosis is, number one, is I think historically, especially where we come from, is we have other burdens of diseases. So for example, we have HIV, we have TB. Yeah? So usually, if I would make a case for HIVs, patients would present with, for example, weight loss. They might present with hair loss and so on. So the first thing that would come to our mind whenever you're in this part of the world is, does this patient possibly have an infectious etiology to the manifestations they're having? But then lupus can present the same way a HIV patient could present, for example. So we are creating awareness, especially amongst our frontline healthcare providers, our doctors. As you rightly put, we don't have enough workforce in this country. As I speak now, we only have 12 rheumatologists in the whole country.
That is nationwide?
Nationwide, yes. Yeah, so that's a drop in the ocean for sure. Yeah, but we also have other specialists who are able to pick up the diagnosis of lupus. But having said that, diagnosis of autoimmune diseases is a complicated one because you need certain criteria. Some of them are laboratory criteria, and the lab tests that are involved are not widely available outside there. And not only are they widely available, they are also quite expensive. Yeah.
All right.
Yeah, so it takes a lot to make a diagnosis of lupus.
So for somebody to know what to expect when they visit a health facility, how is this diagnosis done?
So for you to make a diagnosis of lupus, you need to have what we call a high index of suspicion in terms of the clinical presentation. And once you have this high index of suspicion, there are certain laboratory tests. There are actually basic tests that sometimes can point you towards a possibility of a diagnosis of lupus. So for example, a patient can just present with anemia, and the anemia is unexplained. So that we need to think about, could this anemia be an autoimmune cause? If you look at a blood count, for example, they could have reduced white blood cells, they could have reduced platelets. They could come because of the effect of those cell line reductions. So if the platelets are reduced, they could come with bleeding tendencies and so on. Sometimes patients would go, for example, to the kidney doctors because their kidney functions are declining. So when they do a basic urine test, you can see a lot of proteins in the urine, and that should raise suspicion of autoimmunity. Other manifestations, the lungs could be involved. So a patient could come with what people call water in the lungs, so water in the lining of the lung cavity. Here, most times people would think about TB, but lupus should also be what we call a differential diagnosis for that. So the thing is, you need to have a high index of suspicion. And once you think about autoimmune diseases, think about the demographics of the patient. Demographics, as we need to mention, lupus is more common in women, especially in the reproductive age, in a ratio of 9:1. So you find 9 females to 1 male who have lupus. So if you have a patient who is in the right demographics, has symptoms which you cannot explain, it's important for you to think about lupus. Yeah. And then there are some other tests that we can do. These are specific tests, what we call the antibodies. Remember I mentioned that it is your antibodies which are attacking the body. So we can screen for those antibodies, and this can help us clinch the diagnosis of lupus.
All right. The most unfortunate bit about this is that for that diagnosis to happen, sometimes it comes a bit late and the damage is already done. When we are talking about such diseases, every day matters. So every day matters. So the longer it takes for you to get that diagnosis, the worse it becomes as the days go by. So we really hope that this awareness is going to help not just even the health professionals, but even the patients themselves to know when to present themselves for checkup. But Winnie, getting that diagnosis that you have lupus, how did it change your professional or even personal life? How did things begin to change for you now that you were confirmed that you had lupus?
All right. I think my diagnosis was a turning point for me because, you have suffered pain, unexplained fatigue. You go into the hospital. Sometimes you're told, we don't know what's wrong with you. So I think for me, when they put a name to what was really, really bothering me, then I told myself, wow. So there is something called lupus. And of course, the first thing you do is to go to Google. And you know what Dr. Google does? Dr. Google killed me immediately. I saw all the complications in my eyes and I was like,
it was
my
too much.
God. But then I was also, I think I was very happy because, at some point people started talking. Like, how can you just be sick all the time and there's nothing wrong with you? Are you bewitched? Is there witchcraft in this? Or do you have HIV and you're not saying? So for me, just putting a name to what was ailing me really changed my life. And from then on, of course, at first, you go through that period of grieving for your health. You go through denial, you are accepting, and it's a mix of emotions at the initial times. And it's quite tough because during those initial times, you have gone through what is called a flare-up. And I think Dr. will tell you more about that. A flare-up is when the symptoms of the disease go quite so high and, you know, everything is just confused and everything is wrong. So at that particular time, I think I remember I somehow decided to shut out everyone because first of all, I wanted to understand what is going on with me. Of course, you're tempted to ask these questions like, okay, why me? You know?
And this is a lifelong journey that you start.
So why me? Yeah. So I had those moments of, you know, denying, then I move, I think I want to accept, but no, how can I? And then, you know, when you start learning about it and reading and listening to other people, actually, I also went to Facebook and I started following Lupus Foundation of America because at least they were a bit, they started creating awareness. And just reading those stories, I knew that I would not even last for 1 year. So in terms of work, it was also quite a challenge because one thing that is very, very challenging for me is fatigue. There is extreme, unexplained, and, you know, fatigue. So even if you have the best sleep at night, you will wake up and you are
tired.
So
tired, yeah.
So sometimes you're even tempted to, you know, call in sick because your body doesn't even want to move from the bed. But I think in terms of work, I have really tried to, in the spirit of spreading awareness, I spoke to my supervisor. I have written a lot about lupus. I share with my colleagues. So people are trying to get an understanding of what it is. So sometimes even if I tell my boss that I need to take a break, she will understand and she will allow me to take that break because my body, when my body says no, I have to respond. I have learned to listen to my body. Anytime it tells me, and I think I can tell when I am about to get a flare-up because I will know, I will feel the pains. There would be joint pains. I would have
But that has come after some time of really monitoring what is happening within you and understanding how your body responds.
Absolutely.
So you can tell when things are about to get bad. And prepare.
And I can tell when I need to go to Dr. Otieno.
All right. So, Dr. Is lupus contagious?
That's a good question. So, lupus is not contagious. That's a short answer for that. Lupus is, we know there is the etiology of lupus. There is some genetic aspect to it. So there are certain genes that have been identified in people with lupus. So genes are what determine what happens in our bodies. So genes sometimes direct the immune system to do the wrong things. So it's saying, strictly speaking, could be a genetic disorder, but then there are other many factors that are involved in causing lupus.
That's where I want you to take us.
Yes, yeah. So people with lupus, we know that there's that genetic exposure, but not everybody with that genetic exposure will develop lupus down the line. So what does that mean? So that means that there are certain factors which we call environmental factors that have to interact with your genetics for you to develop lupus. And many of these factors have been postulated. Some of them could be viral infections. So there are certain viral infections that we know can switch on the state of autoimmunity. The hormone estrogen has actually been postulated to be very important in switching on the development of lupus. And possibly that's why we see more women affected by lupus as compared to men, because women tend to have higher levels of estrogen. Another key factor that has been shown to cause lupus, but also cause flares. Flares, what Winnie was talking about, is the ultraviolet light, so the sunshine. So one of the mitigating factors we urge all patients with lupus is to try and avoid direct sunshine. So protective mechanisms. And there are many other factors which are thought to interplay with your genetics to bring about lupus.
As I was prepping for this show, there's some information I came across that the condition occurs more often in people of African and Asian origin as compared to others. Is there any possible explanation to this trend?
So yeah, so data from the West shows us that not only does it occur more in the black population, but then the people of black descent tend to get more severe symptoms. Yeah, so there could be a genetic explanation to that. So you find Caucasians tend to get less severe forms of lupus, but then people of black descent tend to get more severe forms. So where you get organ involvement, so the kidney involvement, the other internal organ involvement. Yeah.
No wonder we should talk about it, because we seem to be carrying like the biggest burden on this other side of the world. Yeah, many cases are reported on this other side of the world compared to the Caucasians. Now, in terms of stigma, because the reason I asked Daktari whether it is contagious, I'm sure from a personal perspective, Winnie, and even in your world as you raise awareness about this condition, you have had stories, you have had myths, you have had misconceptions and misinformation about what lupus is, how it's spread, and even how people with lupus live their life. Tell us a bit more about your experience in terms of what you think is information we should change using this platform.
I think one thing that is making lupus not to be appreciated like the other chronic illnesses is because it's an invincible condition.
Yeah.
If you look at me, would you know I have lupus?
I wouldn't guess.
Exactly.
Yeah.
So we are fighting a lot of invincible wars, and people cannot see it. And one thing that I'm proud of all lupus warriors is we are good at hiding the pain. We are so good at hiding the pain. Why? Because we are afraid of being judged. We are afraid of being called lazy. Because if I sleep and I am so energetic and then I wake up the next day and I can't do anything, someone will likely think that I am trying to pretend or just trying to look for attention. So we really try, we have mastered the art of just hiding this pain because we don't want to be judged. We don't want to be discriminated against.
What's the most unfortunate cases or stories that you have had that people with lupus have had to go through or endure?
I have heard that people have lost relationships. They have lost their jobs. Especially for the women, the spouses have lost patience with them. And these relationships have broken just by the mere fact that they think you are seeking attention. Yes. So for us, that I've had a lot of those such stories. Even at the Lupus Foundation of Africa, I have had a lot of people say they can't work and their employers have failed to understand what they are going through. So they have lost their jobs at some point. And if you look at the members of our foundation, a good number don't work because of the challenges that come with lupus and, of course, the way people want to treat them at the workplace. Yeah.
All right. Doctor, in terms of treatment, what are we looking at? What options do we have? And in terms of access to that treatment, what is the situation as well?
Okay. Yeah, so lupus as there's a socioeconomic effect in terms of the burden of not only the diagnosis, but also the treatment. So just to take you quickly through the treatment, then we'll talk about the effects of the treatment. So treatment for lupus, we have what we call symptomatic management of the symptoms. So we had talked about pain, so sometimes we give them pain medication. But then there is also treatment that is directed against the immune system, which is doing the wrong things. So there are medicines that we use that try to dampen the immune system a bit, and that stops the inflammation, and that clears the flares. So there are certain medications, for example, steroids. So steroids are very good in terms of stopping the inflammation suddenly. Then there are other drugs that we use long-term. Commonest amongst these is the anti-malarial drug, one of them called hydroxychloroquine. So hydroxychloroquine is very useful in terms of skin manifestations, the joint manifestations, and we talked about fatigue. So hydroxychloroquine helps a lot in terms of mitigating the fatigue that patients with lupus have. We also have other drugs that we can use depending on the organs that are involved. These are called the immunosuppressive medications. So in this class, we have drugs like methotrexate, azathioprine, mycophenolates, And the newer kid on the blocks, the drugs we call biologic treatment. Having said that, treatment depends on what manifestation somebody has. So we tailor-make treatment for different patients of lupus. These drugs come at a big cost to our patients. And I think that's one of the barriers that we see in terms of quality of life amongst our patients. The thing about lupus is as we create awareness, we also want to make appeals, especially to our insurance companies. It's good that we are talking about lupus now that we are the eve of the Social Health Insurance Fund.
Yeah.
So our appeal is for patients with lupus and autoimmune diseases in general should be given a consideration, because if you treat these patients early, then you can avoid a lot of the complications that they do get. If patients come down with complications, then it becomes more difficult to treat them. So usually when you get your patients early and you cut off some of these clinical symptoms they have, then you actually prevent the more serious symptoms that they may get. Yeah.
True.
Yeah.
No wonder we said every day counts.
Sure.
The longer they take to access treatment, the worse their situation gets. When you talk to us about that cost burden, is it how are you managing? You know, is it out of pocket still, or are you covered? Or let's just get to understand in terms of how even policies and laws, you know, are sensitive to those who have lupus in our country.
All right. So first of all, like Dr. Ria said, the management of lupus is quite expensive. If I tell you that in one hospital visit you can spend at least 50,000 Kenya shillings, and that would include your consultation, the tests that you need to run, because we're always running tests so that the doctors are sure that we don't have any markers that show there's an infection, there's an inflammation, or that the disease is getting worse. And then you have to take your medication. A lot of us take between 15 to 30 tabs in a day.
In a day?
Yes.
That's
so,
daily?
Yes.
You don't miss your drugs?
Yes. And if you miss your drugs, you are sure you will flare up. So a lot of our patients, and in our foundation, we get a lot of these cases where people are really even struggling to get that transport fare to go to the hospital. So imagine if you cannot get transport to go to the hospital. That means you don't have money to pay for your consultation, you don't have money to pay for the tests. So it's really, really quite a challenge. And most of us do not have an insurance. Even the National Health Insurance doesn't cover a lot of the services that we need from the hospital.
So it's still out of pocket?
It's mostly out of pocket. And even if you have an insurance, that insurance is capped. And remember, you are in the hospital monthly or quarterly or even biannually. But if you are in a hospital monthly, and there are even people who have appointments weekly because they need to be monitored. So it becomes very expensive that even if you have an insurance, it runs out at some point. And when it runs out, what does that mean? You have to pay out of pocket. So it is quite costly. It is very, very expensive for most of us.
Earlier when you were talking, I told you, we were just talking about how you got your diagnosis and how now this reality of this lifelong journey was put on the table for you. Actually, just to understand how this treatment works, somebody may be asking, so when I get treated, do I get healed? Am I off the hook? What happens?
So lupus is a chronic illness.
Yeah.
Simply put, is a lifelong illness.
Yes.
So once you have lupus, you have it. There is effective treatment to treat lupus. So the aim of treatment is to take you into a state we call remission. So remission is a state where you have the disease, but there's nothing really happening in terms of the effect of the antibodies on your system. So we cannot cure lupus, but we can actually treat lupus. Yes.
That's why what Winnie is saying is really important, because if you are spending 50,000 in a regular hospital visit, you can imagine how much you're going to have to spend to be okay, because this is a lifelong journey that now you have to manage, you know, the condition that you have. But then again, if it comes with cost implications, costs that you cannot afford, what does that mean for us? We are going to have more people go down with lupus. which is something that we should do. Probably, Dr. has proposed some of the things that he feels would make this burden lighter. But Winnie, from somebody who has worn that shoe, also in addition to what Dr. has spoken about, I know now you're running, campaign and awareness about this condition. What would be your clarion call in terms of how to make it easier, how to make it more bearable for people who are battling with lupus in our country?
All right. I think the most important thing when you have a chronic illness is to get support. And support is financial, support is emotional, support is spiritual, and just that range of psychosocial support for you. So it is, I think the one thing that we're struggling with is because people don't know about lupus. And if you don't know about it, there's nothing you can do about it. So what we are trying to do is to create a lot of awareness. Through the Lupus Foundation of Africa, we are encouraging our members to keep speaking about it. Because, when I speak about it, then you learn. Because I personally didn't know about it. So for me, just speaking out and creating that awareness, number one, it will help us because then even when we go to, say, the government, and request them, please, we want to be included in the NHIF, it means that because if they don't know about it, then there's nothing they can do about it. So for me, knowledge is very critical at this point, that people just need to know there is this condition, this is how it affects people, and let us try and support each other in a very, in a positive manner so that we all have better health outcomes. And we have a patient support group as well. I think a support group is also very important at home, in the family, and even at the places that we work in. If you find that support, then you're able to bear, the burden becomes lighter. I think for me, when I joined the Lupus Foundation of Africa, I felt some relief. Because at first I knew I was alone. Because I have never heard of anybody who has lupus. So when I joined this support group, it really gave me the courage and the push to carry on because I met a few others who are like me. But right now, we have grown and we are so many and we are bringing on the new people, the newly diagnosed people, and just trying to hold their hands and tell them that, this is something that we can manage. Yeah. So it's that awareness creation and just appealing that, for that support. Support could be from the family, it could be from the larger community, or even just what the government, the package that the government can provide for us in terms of the health insurance. And even the private health insurers, they have some sort of stringent conditions that you have to meet before you are in the cover because you have a chronic illness.
Talk to me about how you have adjusted your lifestyle so that the treatment plan also works for you. Like how is your life looking like now compared to how you used to live before, even in terms of meal plans, in terms of your schedule, in terms of rest? What is it that happens for somebody who could relate with what you're going through and they may not be knowing, how do I now live with this disease? How do I get to the space that you are sitting in, talking very boldly and looking healthy and, thriving in this?
I think the first step is acceptance. Once you accept that you have this chronic, lifelong, and threatening condition at the same time, then you begin to live a positive life. Through our foundation, we are also teaching each other about the coping strategies and just self-care. Because you know that sometimes you have hospital fatigue. You just get tired.
Hospital fatigue.
Of being treated, of being on medication. So what for me, what I did was, I first of all accepted that I have lupus. Then I started talking about it. And when you talk about it, it becomes a bit light because people around you understand you and they are able to better support you. So for me, that speaking up really helped me. Also, one thing I would encourage our warriors to do is, please, please, work with your doctor. I know sometimes the doctors put you on so much medication and, you have to do this very many visits and you get tired. And some of us just, give up along the way. If you give up, you wouldn't get where a lot of us have gotten to. So it's important to work with your doctor. Take your medications. I take my medications religiously. If I need to do a hospital visit, I will do it. And also one thing, Dr. Tino introduced me to a certain therapy called rituximab. So that injection has also really helped me. However, the injection is quite costly. It's quite expensive. If you go to the hospital, you might as well spend up to 500,000 just for one single injection. But it has also helped me. Also, I have tried to change my diet. Just what I eat, just being careful about what I eat. In our patient support group, we share a lot about some of the foods that when you eat can cause inflammation. So I've tried to reduce on that. I am also, I've tried to think about me first. If I have to go to a place where there is a crowd, I have to be very careful because the infections with other people can catch me and
you're more at risk.
Yes, I'm more at risk, and it can give me a really serious flare-up. So I have learned to take care of myself. And if I cannot join you, I won't join you. So you can think what you want to think, but
you come first.
I come first.
So self-love actually makes sense now.
Absolutely.
To you more than
yes.
ever.
And also learn to block the negativity, because of course there are people who will come with negative comments. They will speak about you like, oh, you're suffering from HIV, you don't want to tell people you're suffering from these serious conditions that you don't want people to know you are lying that you have this. So it's to block also that negativity and just remain positive. I know it is hard. A lot of us are really struggling. I have held a couple of hands for most of the newly diagnosed. Dr. Beryl from Eldoret sends me so many people that I don't know. Just tell them, talk to Winnie. And I think with that, just also having someone hold your hand, that support system for me, that's what I would say.
One thing that stands out for me is that the power of having a positive mind and having a positive attitude towards something actually can go a long way in helping you win the battle that you have ahead of you. Because you say where you started is acceptance. That is where it begins. And then you become your own advocate in your own space in case you have lupus. You're the one to talk about it. You're the one to teach people about it. You're the one to make them understand what you need in terms of care, in terms of support. So you can imagine how that is going to work if you yourself, you have not accepted that you have lupus and it's okay. And now let's begin this journey. Yes. And we are going to win this war. So self-acceptance is what I get from what you're telling me. Dr. Ari, just to add on to what she has said, concerns about some of the things that patients do that probably would compromise whatever health outcomes you're trying to achieve with the treatment, you know, things that you'd warn them about, the don'ts, when you're now in that journey of managing lupus. What are some of the things that you're supposed to be very careful and cautious about?
Yeah, so the thing is, number one, once you have a diagnosis of lupus, as Winnie has put it, is we need to accept it, and then we walk the journey together. The key thing is to keep your appointments. Sometimes stable patients, it becomes very difficult for them to want to come to hospital. But there are things that can happen to patients that you do not feel. So for example, your kidneys could be declining, but there are no really symptoms that would tell you that that is happening. So when you come to clinic, we do basic tests, for example, just a urinalysis. We are able to pick some of those things quite early. So it's very important to keep your clinic appointments. It's very important to adhere to your treatment. But then also, we mentioned the dangers. We are in the online world now. So there's a lot of misinformation outside there about certain therapies. So it's important to consult your doctors before you attempt to use some of those medications, because some of them sometimes can be very detrimental to your health. Some of them could cause you certain side effects that would even make your lupus get worse. Sometimes they also interact with your medications and either make your medications cause you more side effects or make your medications not work. There's this craze about supplements. I see it a lot amongst patients. So it's very important for you patients to consult before you go into some of those therapies. Of course, the whole thing is also very important to have that psychosocial balance. Yeah, so psychosocial support is very important for patients. Yes.
All right.
Yeah.
Talk to us about lupus in children, because if you're of age and you can feel this pain and you can talk about it, then it's easier to get treatment or to get checked. But there are children who could be having lupus, but they cannot speak for themselves. So talk to parents on the telltale signs, what to observe, what to do, so that they can also be very sensitive to pick up whether something is wrong and it could lead to a diagnosis of lupus at the end of the day.
Yeah, so lupus is rare in children, but lupus can occur at any age. So it can occur just immediately after birth, what we call the neonatal lupus. And this would happen more in mothers who have lupus. So there is that maternal transfer of antibodies.
So it can be passed from a parent to a child?
Exactly. It can be passed from a parent to a child. And these babies, they usually certain antibodies that when we do during the antenatal period, we could actually predict. There are certain advanced tests that can actually predict the occurrence of neonatal lupus. But patients with neonatal lupus would present with certain features, so certain skin manifestations, and it's important that mothers who have lupus and have that higher risk of getting neonatal lupus get into care. But as children go into early childhood, it's a bit rare, but the presentations would also be the same, almost like adults. So sometimes very subtle things like anemia or even joint pains and so on. So joint pains in children can be a tricky thing to see because children will not tell you.
Yeah.
But you'll just see your child possibly is not playing with other children.
As usual.
Yeah. So when you see such things, then you should have a high index of suspicion and just get your child checked. Yeah, it could be lupus. Yeah, yeah.
It could be anything, but then again,
Yes,
it could be lupus.
exactly.
So it's better to be safe than sorry. Yeah. All right, we've come to the end of the conversation. By the way, did you know that Grammy-winning singer, producer, and actress Toni Braxton has been living with lupus for about 16 years, and she's a warrior just like Winnie, and she's doing some amazing work just creating awareness and campaign about it. You can check her online and find out more about what she has been saying. Winnie, we encourage you to continue doing what you're doing, just bringing others on board and telling them it's okay. As we wind up this conversation, what would be your words of hope to somebody who could be battling lupus this morning and they just need to hear something to give them that boost to come back and fight and win this battle?
It is possible. We are warriors, we are fighting, and a warrior never gives up. So one thing I would tell my fellow warriors, let us not give up. Let's keep fighting. Let's keep fighting for our lives. Let's keep fighting for our health. Let's even keep fighting for our family because there are people who depend on us. So it's not just, let's not give up. Let's not give up. That's all I can say.
All right, thank you so much. Daktari, your parting shot?
So diagnosis of lupus is not a death sentence. There is treatment that is effective, and especially if given early to lupus patients. So my great appeal to our stakeholders, especially the government, please let's support lupus patients. Thank you. Let's support lupus patients. That's what a way to end it. Thank you so much for creating time, both of you. I was engaging this morning Dr. Fred Otieno, a consultant rheumatologist at Aga Khan University Hospital, and also this morning, Winnie Opondo, who is a lupus warrior. Thank you, ladies and gentlemen, for creating time, and thank you for watching Daybreak this morning. We really do not take your company for granted. Continue interacting with us on social media at Safina_Cheng, at Citizen TV Kenya, and at Ayub Abdikadir. For now, that's a wrap, and continue watching Citizen as well. We still have more that we have lined up for you.